Good morning and welcome, everybody. I'm David Sandman. I'm President and CEO of the NYSHealth Health Foundation. Thank you all for joining us this morning for our annual conference on veterans health. This year, we're focused on veteran suicide and particularly the governor's challenge to prevent veteran suicide in New York State. We're going to start with a keynote address, followed by two panels. Suicide, of course, is a painful and difficult reality. And our first panel will address how to best talk about the topic. And our second panel is going to dig deep into the governor's challenge, what it is, what we've learned so far, its impact, and what lies ahead. Be sure to come back tomorrow and join us again for part 2 of the conference. We know that Zoom fatigue is real, so we've deliberately split up the days. Tomorrow, we'll focus on veterans who are most at risk of suicide and creative ways to use legal services to prevent suicide. Be involved, be part of this conference. I encourage you to use the chat box throughout all of the sessions. Put your questions in there. We'll get to as many as we can. Feel free to put reactions and emojis and resources that are relevant as they come up. So be part of this conversation with us. And note that we're recording the session, so you can watch it back if you do miss anything. And we have closed captioning available for those of you who'd like to use that feature. So with all that out of the way, let's get going. Those of you who might not be familiar with the New York State Health Foundation, we are a private, independent, and statewide foundation with a mission to improve the health of all New Yorkers. And that includes the more than 700,000 veterans who call New York their home. In addition to focusing on veterans, we're committed to connecting people with the healthy food that they need to thrive, and we work to empower healthcare consumers with information about prices and quality and making them partners in their own healthcare. We also have a pool of flexible funding known as the Special Projects Fund, and for the last year and a half or so, we've been using that particularly to address the needs arising from the COVID pandemic. We have a vet-centric audience today, so I can't let the opportunity pass to humble brag about the big policy win we achieved earlier this year, changing New York state law so that every veteran in New York, no matter where they live, has access to a veterans treatment court if they need it. Veterans treatment courts, or VTCs, are a type of problem-solving court that provide an alternative to incarceration for justice-involved veterans who have a mental health and or substance use issue. The evidence is overwhelming that VTCs work. They give veterans a chance to get their lives back on track. It's a point of pride that the first VTC in the whole country was established here in New York, in Buffalo to be precise. But not all veterans in this state had access to what are life-saving programs sometimes, and now that's changed. So I thank and congratulate all the friends and partners who worked with us to make it happen. If we were in person, that would be an applause line. So feel free to put something in the chat if you like. And you can learn more about VTCs and more about the foundation by visiting our website at NYSHealth.org. Join our mailing list. And I encourage you to follow me and to follow the foundation on Twitter to keep up with us on the regular. You can see our Twitter handles there in the chat box. I believe Michelle was going to post those for us. So follow us and we'll follow you back. Whenever I talk about veterans, I always begin by pushing back on the stereotype some people hold that veterans by definition are troubled or broken. That's just not true. When we started this work, we began by listening to veterans themselves. And the first thing we learned is that many veterans come home from their service and they readjust to civilian life without major problems. They're ready to work, they're ready to go to school, they're ready to contribute. And you can put an amen in the chat box for that if you'd like to do so. But of course, we learned that some veterans do have unique needs. In that same assessment, veterans had a risk of a probable diagnosis of PTSD. It was 8 times higher than for those in the general population. They were 2 to 4 times more likely to have major depression, and it follows that veterans are at higher risk for suicide. Last week, the foundation issued an in-depth profile of New York's veterans. You can download that from our website too. And we found that in 2019, veterans in New York died by suicide at a much higher rate than the overall state population, about twice as high as the civilian rate And while in 2017, New York had the second lowest veteran suicide rate in the nation, by 2019, we had dropped to number 16 among states. Every suicide is one too many. 156 veterans in New York died by suicide in 2019, nearly one every other day. And of course, 2020, 2021 have not been easy years for any of us. The COVID pandemic exacerbated key risk factors for suicide: anxiety, depression, social isolation, economic distress, and substance use. Wounded Warriors Project 2020 annual survey of post-9/11 vets found that about half of those they surveyed reported that their mental and physical health had worsened during the pandemic, and 30%, fully 30%, reported having suicidal thoughts within the last 2 weeks. Same survey found that mental health was less accessible during the pandemic, with about half of respondents saying that they'd had a mental health care appointment canceled. And of course, the second half of 2021 has been an especially difficult time for the post-9/11 generation of veterans. The 20th anniversary of 9/11 was triggering for some, and that came on the heels of a violent and chaotic US withdrawal from Afghanistan that saw the Taliban back in power. Recent research shows that 90% of Afghanistan war vets with a history of mental illness are experiencing new or worsening mental health problems after the Taliban takeover, including depression and thoughts of suicide. Our own New York State-based Veterans Crisis Line has seen a 98% increase in the texts that it receives and a 40% increase in online chat requests. So what does that all mean? We have to act with even greater urgency to address veterans' mental health and suicide. It's why the governor's and the mayor's challenge to prevent suicide has been so important in New York and across the country. The governor's challenge is led nationally by the VA and by SAMHSA. We're pleased to have both of those entities joining us today for the conference. Here in New York, the governor's challenge has brought together nonprofits, healthcare and mental health providers, government agencies, including the New York State Division of Veteran Services, also represented in this conference. And my point is that none of us could do it alone. It's going to take real partnerships, real efforts, and cross-sector collaboration to make a difference. And we're going to learn a lot more about the governor's challenge as we move through the day.